Hello, you guys. Angela here with the CNA questions for today. 10 questions a day I try to do for you guys. A resident sister gives her favorite nursing assistant a thank you note with a gift card inside. She tells the nursing assistant that this is a small way of letting him know how much she appreciates his work. The nursing assistant does not want to offend the family, and it happens to be a gift card to his favorite restaurant, so he decides to keep it. Which of the following best describes how the nursing assistant should have responded? The nursing assistant should have thanked the sister for thinking of him, but politely refused the gift. A nursing assistant enters a resident's room to give her a scheduled bath. The resident appears to have been crying, and she says she does not want a bath. Which of the following will be the best response by the nursing assistant? The nursing assistant should respect resident's refusal and report it to the nurse. A nursing assistant is assigned to help a resident who is recovering from a total hip replacement and needs help with deep breathing exercises. The resident is very uncommunicative. Which of the following questions will be helpful in encouraging the resident to communicate? How have you been feeling since I saw you yesterday? A new nursing assistant on the unit is trying to visit with a resident from Nigeria who does not speak any English. Which of the following will be the best response by the nurse assistant in order to communicate with the resident? The nurse assistant should ask if there is an interpreter who can help. Okay, just going over, and you guys see. A nurse assistant has to touch residents in order to do her job. Which of the following is an example of an inappropriate touch? Holding the resident's leg as she bathes it. That's a good example of an appropriate touch. A nurse assistant is documenting a resident's care for the first time. Which of the following is an example of accurate documentation? Record the resident's blood pressure in black ink. When a nurse assistant answers the phone in the long-term care facility, which of the following is the best example of proper telephone etiquette? Good morning, this is Linnell Brooks, nursing assistant at Lakeside Village. How may I help you? During a dinner, a resident throws her plate at a nursing assistant. Which of the following will be the best response by the nursing assistant? The nursing assistant should call for the nurse and stand by to help as needed. A resident husband died recently. She has stopped participating in game night or going in the dining room for meals. She is eating very little and seems sad. Which of the following will be the best response by the nursing assistant? The nursing assistant should give the resident opportunities to talk about her feelings if she wants. And like I always tell y'all, I just like to give the answer, and you can read the A, B, C, D if you want to on your own, but I just like to read and give the answers. Because I remember when I was studying, y'all, I just wanted the answers. That's all. That's it. But I know they do have to do A, B, C, and D. But yeah. Okay. A resident refuses to eat his food. Which of the following will be the best response by the nurse assistant? The nurse assistant should report this refusal to the nurse immediately. If a resident tries to hit a nursing assistant, the nursing assistant should step back and call the nurse. Which of the following is a good guideline for the nurse assistant to follow when communicating with a resident who has a hearing impairment? The nurse assistant should stand or sit so that the resident can see the nurse assistant's face and make sure that there is proper lighting in the room. Which of the following is a good guideline for the nurse assistant to follow when helping a visually impaired resident? The nurse assistant should use the face of an imaginary clock to explain the position of the objects. Y'all, that question is very important, and they usually do ask y'all that in tests. So that question is very important. The imaginary clock, yes, very, very important thing to know. A new resident recently fell and broke his hip. Which is what prompted his move into the long-term care facility. He has become very dependent on others for the first time in his life. Even though the facility is comfortable, provides good medical care, and serves food he enjoys, he is still depressed. According to Maslow's hierarchy of needs, which of the needs could the resident be struggling with? Need for self-esteem. That's another important question. Okay, you guys, I think I did over 10 questions, but that's okay. But thank you guys for watching. I love you guys. And yeah, I just want to be giving CNA questions once a day for CNAs or people who are thinking of becoming CNAs or nurses. Thank you guys. Have a good day.